Don't smoke directly after your dental implant surgery or having any tooth removed. And I'll tell you why. Because it's bad for you. Well, it is. But dentists recommend not to smoke for at least 7 days following your dental implant surgery or having a tooth removed due to the high chance of developing a dry socket in the areas that they just removed your teeth. Dry sockets are incredibly painful. Take it from me, you do not want to experience a dry socket. I'm a smoker and I waited at least 5 days, but everyone's different. So consider waiting at least 7 days or quit altogether now that you've had that opportunity to take a break, because that's a good opportunity to just quit while you're at it. But if you do smoke, wait at least 7 days, because otherwise you may regret it and you may develop very painful dry sockets in your mouth. And especially if you've had multiple teeth removed, you could have multiple dry sockets and multiple issues and a lot of pain. So definitely don't smoke directly after your dental implant surgery. Have a good day.